If you're driven to make a difference, to have an impact, to grow your nonprofit to new heights, then the most important asset you need is a well-executed and scalable strategy. Hi, I'm Tom Kelly, your nonprofit catalyst. You may know me as the CEO of Charity Stay and Donor Books or the author of The $1 Million Nonprofit. What I help nonprofits achieve that gives them significant edge and a clear path to substantial growth is the ability to strategically fundraise and effectively engage their community. And that's what I'm going to share with you right here on the $1 Million Nonprofit Podcast. In each episode, I'm going to take you behind the scenes to reveal the strategies, techniques, and tactics of successful nonprofits so you can avoid common pitfalls and drive your organization forward. Welcome. I'm glad you're here. Welcome to the $1 Million Nonprofit, your ultimate destination for discovering the strategies and stories behind successful and impactful organizations. I'm your host, Tom Kelly, and I'm thrilled to have you join us for today's episode featuring a passionate guest, Harley Jones. Harley isn't an ordinary nonprofit executive. He's a senior manager, domestic emergency response at Project Hope. He's a dynamic force with over 16 years of experience in organizational leadership, education, and fundraising, with a proven track record in crisis management, program development, and innovation. Harley brings a wealth of expertise to our discussion. What truly sets Harley apart is his passion for humanitarian causes, whether it's rallying teams of staff and volunteers or pioneering new initiatives grounded in data-driven outcomes. Harley is committed to making a tangible difference in the world. In today's episode, we talk about Harley's journey, uncover valuable insights into his leadership approach, and the keys to achieving nonprofit excellence. Get ready to be inspired as we chat with Harley Jones on the $1 Million Nonprofit. Harley Jones, thank you so much for being here today.
Yeah, great, Tom. Thanks so much for having me on and having the opportunity to share a little bit about the organization and what we do here in the United States. I'm really excited.
Awesome. Well, let's provide listeners with a quick overview of Project Hope's mission and the key initiatives that you focus on.
Yeah, fantastic. Project Hope is a 65-year-old global health organization, and we started back in the 50s when our founder, a doctor who had come back from the war, was really excited to provide healthcare from the United States to around the world, and that really morphed into the organization that's Project Hope today. And our mission, no matter where we're doing it, in any of the 25 countries that we find ourselves active in the world, our mission is focused on empowering local healthcare workers. And that's empowering those local healthcare workers to do a couple things. Number one, to save lives, period. Let them do their work. In particular, let them face the kind of giant health crises that are affecting people around the world. And really second, to empower those healthcare workers to build more resilient communities and to serve everybody.
And Hope started back in the 1950s. Can you share some of the organization's kind of milestones and significant achievements over the years?
Yeah, the origin story of Project Hope is really a great one. We were started by our founder, Dr. William Walsh, in the late 1950s. He had been a doctor during the war, and he had been, kind of disturbed by the lack of healthcare that he saw in different places around the world. And so when he came back, he worked with the U.S. government to charter a Navy medical ship, and that became the SS Hope. And so for the greater part of 20 years, Dr. Walsh and medical volunteers and Project Hope staff members traveled around the world, working on that mission of empowering local healthcare workers, strengthening local healthcare systems, and taking care of local populations. Fast forward to now, the SS Hope had been decommissioned many years ago, but that's been replaced by Project Hope staff members, technical experts, and workers all over the world in about 25 different countries who continue to work on that mission of empowering local healthcare workers and strengthening those local systems in a way that takes care of the local populations and makes sure that they have what they need from a healthcare perspective.
Nice. And how did you become involved with Project Hope?
That's another really great question. I spent 20 years of my career in the nonprofit and emergency management space. So I worked early in my career with the American Red Cross, and I got a lot of experience traveling around the country, around the world, responding to emergencies and disasters. And it was during the pandemic that I had the opportunity to come here to Project Hope. And at the time, Project Hope, while we continued our work in countries around the world, we also saw a huge opportunity to be helpful for the people here in the United States. And I think more than anything, the pandemic showed us an opportunity, but also reminded us that sometimes in the United States, your ability to access healthcare sometimes depends on where you live, sometimes depends on how much money you make, and sometimes depends on things like your access to insurance. So it was early in 2020 that I had the opportunity to come to Project Hope with my expertise and really lead our efforts in responding to the pandemic across the United States and helping local healthcare systems. And once again, focusing on our mission of empowering healthcare workers across the United States to take care of people during and after the pandemic.
What insights have you gained from other nonprofit leaders that have influenced your approach to leading Project Hope?
Fantastic question. I've had so many great mentors in my life, whether it was from a leadership perspective or even oftentimes some of the people that were on my teams that taught me a lot. A couple of the big leadership lessons for me that jump out in particular are about relationships. I know I've listened to a lot of the episodes of your podcast. I know you've talked to a lot of leaders, and it's one of the things that I've learned is that in this nonprofit business in particular, we can't do it alone. Problems and the things that we are trying to address are massive. And so only by working together and collaborating with other leaders and other nonprofits can we really make the kind of impact that we need to make. So that would really be the first one, is that real focus on trust and building relationships. The second one that I would say is this, I think it's really mission-driven focus on the people we want to make an impact with and the people that we want to serve. I think, a lot of times the old school mentality is that people can come in and help other people, when in fact it's more about empowerment. It's more about engaging the folks that you want to make a difference with, the people that you want to help. And so having this really from the ground up mentality of engaging with local populations, of engaging with the people that you want to work with, and making them not only the recipients of the kind of impact that you want to make, but making them the drivers, the leaders, so that they have a voice in the work that you're doing in whatever community you happen to be in, whether that's around the world or here in the United States. Those are two of the big lessons that I've taken, not only from my mentors, but from the people I continue to work with day to day.
Yeah, I feel like it doesn't matter if you're working for a for-profit business or a nonprofit business, you always have to be learning. Everybody needs a mentor no matter what. There's always a new level of growth that you can, achieve for yourself that will help the organization, succeed in the future. And no matter what, there's always new skills to learn and implement. And I think everybody needs to kind of keep going.
I couldn't agree more on either side of that equation. And I mean, one of my mentors mentioned that very early to me, like the second you think that you're the smartest person in the room is the second that you stop trying to learn. And that's bad, right? And to your point, always being open to learning new things, especially when you're working to support populations who sometimes don't always get access to the same thing that everybody else does. And so making sure that their voice is paramount in that conversation as you're building programs or building opportunities, that's really the most important thing. I couldn't agree more.
Does Project Hope establish and strengthen the connections with the communities that you serve?
It always starts from those initial conversations. So whether we start by building trust, which means we're just quiet and we listen. To your earlier point about learning, wanting to listen and learn about not only the things that make them unique, the people that you're working with, the partners that you create, knowing and understanding their mission, knowing and understanding what they want to see happen with them and the folks that they take care of. And so we do that by listening. We do that by working together and creating programs, opportunities, going after funding, putting partnerships together in a really sophisticated and strategic way. We don't pretend to have the solutions to problems. We put those problems on the table and we sit down with partners and we discuss them. A perfect example of this is one of the biggest areas of growth for us, and that in the providing of training and capacity building for mental health and resiliency support for communities. After the pandemic, in particular, communities were really hard hit. Every single person in the world, right, dealt with the pandemic in different ways. And so one of the areas that we've seen the opportunity to grow is to come in and to provide training and capacity to give folks mental health and resiliency training to not only care for the communities that they work with, especially for frontline healthcare workers, but also the tools to care for themselves, to deal with their own trauma, to help them have the resiliency to continue to do the work that they do. And sometimes what we found when we build trust and build new relationships, in particular, I think about a partnership that we did with the Yuchi tribe in Oklahoma. And one of the things we realized is what would be even better than simply providing them with the training and the materials that we have around mental health and resiliency is let's work with them. Let's translate that into their own native language so it actually connects with them in a cultural way that is specific to them. And after we were able to approach it like that, it took on an entire different meaning. Going through that process with them, not only put those materials and language into their own cultural context, but it took us through a process that built trust, built relationship, and made the partnership even stronger than it was before.
And so over the years, do you have, can you provide any examples of successful collaborations with Project Hope? And has it led with local organizations to enhance, and cut that out. See, that's fine.
That's okay. It's not just...
And then I'm going to restate the question here. So that was a good example. You kind of went in my next question. I'm going to ask this question again. If you don't have another example, we'll kind of use the other with the tribe. So can you provide an example of a successful collaboration with Project Hope that you've had with local organizations to enhance its impact?
Great question. I've got a great example. And that's what I would consider kind of one of our most substantive partners. And that is the network of free and charitable clinics that exist in the United States. There's some great partners that we have, and I'll always call them out. The National Association of Free and Charitable Clinics is kind of an umbrella organization for more than 1,400 free and charitable clinics across the country. And these clinics in particular provide health care to people who have no insurance or can't access traditional healthcare systems. And I'm not talking about government assistance. I'm not talking about other parts of insurance. I'm talking about people who have no ability to pay for healthcare. And so these free and charitable clinics are tremendous partners of ours. In 2022, we had a huge opportunity to collaborate and bring together more than 47 of those clinics when it was paramount across the country to provide not only access to COVID-19 vaccinations, but to help support those communities that were hesitant because of a lot of the information that was out there, good, bad, or indifferent, so that they could make a good choice for them and their families. And so that provided us the opportunity to bring resources, to bring training and capacity building, but most importantly, to build a network of more than 47 free and charitable clinics who wanted to be a part of this effort, but didn't have the capacity to do so. And the beauty of those clinic partners, and there's hundreds of them across the country, is that they all look different. They're all a direct reflection of the communities that they serve. They've all built trust up within their own community. And for 20, 30 years, sometimes they've been providing that access to healthcare that these populations just can't access for many, many reasons. And so that successful opportunity for us to bring those clinics together around this mission of informing, engaging, and providing access to the folks that they serve, to their patient population, was a huge success for us, and really showed us the opportunity that if we can bring like-minded partners together, one whose values are conducive with our kind of approach to the populations that we want to serve based on our mission, then the sky is really the limit. And we've continued to find ways to do that. We started in that kind of COVID vaccine world, and we found ways to do that now and move to things like non-communicable diseases, things like how they're helping patients manage diabetes and hypertension, all the way to the healthcare crisis that is coming as a result of, the number of migrants coming in and settling across the United States. How are these clinics being provided the support to take care of more and more people every single day is a huge focus for us as we move forward.
And you personally, how do you cultivate and communicate a strong sense of purpose within your nonprofit's within your leadership within your?
It's about mission. I've been in this industry for 20 years. I've had the opportunity and the luck to work with some tremendous leaders. And in each of those opportunities where I've had the opportunity to lead, it's been about mission. It's been about creating that environment for my team and for my volunteers and for the people that I work with, what we're trying to do. And so for us in the United States, taking that global mission of empowering local healthcare workers and making that applicable here in the United States has been the focus that we've done, and we built everything around it. Because we bring that humanitarian focus in of supporting local populations and the healthcare workers that support them, that really creates the opportunity for our team to build around that. It points us in the right direction, and it gives us the foundation to go out and find partners who think the same way that we do. The second thing that I would say is that not only do we truly believe in that mission, but we practice it on a day-to-day basis. So when we come in and we meet a partner or we're building trust, we do exactly what we say we're going to do. We shut our mouths sometimes and we listen to the needs of local populations. We listen to the needs of our partners. We co-build programs and opportunities with them, and we do what we say we're going to do. That's an extremely important part of leadership. And so we also find that creates a really great environment for the team that we work with and the volunteers that we bring around the table. And then the last thing that I would add to that is I would say my own personal set of values that are rooted not only in that mission work that I do, but in this belief that every single human being has a right to be healthy, that has a right to healthcare, has a right to be treated in the same way that you and I want to be treated on a day-to-day basis, as well as this understanding that how healthy you are shouldn't always just depend on how much money you make or where you're born or the color of your skin. It's really this universal approach and this understanding that being a human being comes with a set of values, and that's really important to us and to me personally as I think about the work that we do.
Yeah. How does Project Hope remain adaptable and responsive to the evolving community needs and global health changes and challenges?
That's a really important question right now, in particular in the global space. We talked about it at the top. Project Hope is always engaged around the world. Sometimes it's in response to health crises. Sometimes it's in response to emergencies. Sometimes it's in response to armed conflict. Project Hope, like many other organizations, is active in many dangerous places around the world, whether it's in Gaza, whether it's in Ukraine, or it's post-disaster here in the United States when a hurricane affects an entire state or an entire region. And so a couple of things jump to mind. Number one, we're focused on that mission. So it's really easy for us to be nimble and to be responsive because we're always focused on that mission of empowering local healthcare workers. And we can do that, and we can figure out how to do that in an armed conflict setting. We can figure out how to do that post-disaster, but it's always that focus on what those healthcare workers and what that healthcare system needs. At the same time, we train, we exercise, and we maintain a roster of some of the most skilled humanitarian workers that I've ever seen. And so when situations change, when things happen, that we fall back to that training. We fall back to the work that we've done to prepare for those things. And in particular, we rely on those relationships that we spend every single day cultivating, those partners that we're building trust with, so that when those partners need help or something changes and we need to build a new program or we need to change something else, that we can do that. We're seeing things like that as the political situation in places like Haiti changes almost on a day-to-day basis. That affects health programs and partners that we've had there for years and years. And so our ability to be nimble and responsive to to not only the needs of our organization, but the partners that we have around the world is really important as well.
What do you see as the next frontier for nonprofit innovation, and how is Project Hope kind of preparing for that?
Great question, and it's really nuanced, both on the nonprofit side, on the healthcare side. I think we're really interested in the effect that things like AI are going to have on the healthcare system overall, and so making sure that we are utilizing tools around the world that help us to, not only track our programs, but the progress that we're making in affecting the healthcare outcomes of the people that we're serving around the world, no matter what that looks like. I think we're really interested in how that's going to transform, the nature of the healthcare systems all around the world, especially here in the United States, as those kinds of technologies are adapted into those things. The other one I would mention, and I know it's one you often talk about with a lot of your guests, and that's the continued focus on sustainable funding mechanisms, the way that we track impacts, the way that we communicate with donors, the way that we show impact with our partners, and the way that we turn that into opportunities for sustainable funding for us as we move forward. We continue to remain focused on building those relationships and being really sophisticated in the way that we work with donors and funders, co-building those programs together, making sure we know and understand what impacts are important to them so that we can continue to do that work down the road. And the other focus for us in particular, especially because we spend so much time building relationships and working with local and frontline healthcare workers, is how can we make the work and the programs that we are implementing sustainable so that we can have, longer term impacts on the local healthcare systems that we serve. And that's as relevant in places around the world as it is here in the United States. As we see the changing landscape of the healthcare environment here in the United States, how do we make sure that people in rural areas are continuing to be served? How do we continue to address things like health equity? And how can we use innovation and technology to do so? How can we make sure that everybody has access to healthcare no matter where they live or their connectivity? How do we make sure that we kind of collectively find ways to increase the positive healthcare outcomes for everybody, regardless of where you live, regardless of your income level, and regardless of many of those things that sometimes create barriers for us to taking care of our own health.
Mm-hmm. How important do you feel telling the story of the impact is back to the donors that support Project Hope? And is there a certain thing that you guys focus on when it comes to keeping them informed of how their donation has made an impact, and how important is that?
It's really important, and I think it's getting more important every single day. The more work goes into that, the more sophisticated individual donors get, the more expectation they have. And at the end of the day, I think whether we're giving, $5 ourselves to a charity, or we're looking at some of our large donors, every single person wants to know that the funding that they're giving is having an impact and doing what they want it to do for the people that they want to support. So I think, number one, we have to acknowledge that it's really important, and it's our job to do, to both have that impact, but be able to communicate it in a way that not only makes people feel good, but sees the nonprofit sector and the work that we do as a strong investment, as an investment in people and humanity overall, even though it doesn't always look the same as the for-profit world. The second thing that I would say is that for us, it's about communicating regularly. I go back to those relationships that we've talked about. A relationship with a donor is not just a once-a-year conversation when you send a report. It's a constant relationship in which you're sharing the challenges, you're sharing the successes, you're sharing those impact numbers, you're sharing that progress to the expectations that you've always had together. At the same time, how do we leverage those relationships, and how do we bring additional partners to the table to not only meet the expectation of donors, but how do we continue to exceed them? How do we increase the sophistication of the work that we're doing? How do we increase that impact and bringing additional partners to the table is a great way for us to do that. And I think just being able to communicate that regularly in a way that allows those donors to see you as partners in that work is really, really important.
Yeah, I think that what you just said there was pure gold. I think that will help a lot of organizations rethink the way that they communicate with their donors, because I do feel that being able to show a donor the impact that their contribution has had is just going to solidify them as a future donor to your organization. And I think a lot of smaller nonprofits get that wrong, and they don't take the time to really kind of show the impact back to the donors, and they might do a generic, communication, but I think really kind of narrowing it down is the right way to do it, especially if you want long term.
Yeah, well said.
So my last question here is, when you've had a lot of success with the leadership role that you have with Project Hope, what advice would you give other people that are working for nonprofits that are aspiring to grow their experience, their talent, become executives or on a leadership team and run a nonprofit? Like what experience would you have with your many years of experience in the nonprofit world and leadership? What advice would you have for them to kind of get that?
Lots of advice. Number one, I think you said it earlier. Don't ever stop learning. Don't ever be afraid to take risks, even if you're going to make mistakes. And I'll tell you that a majority of the things I think I've learned in this business, come from risks or mistakes that I've made. And that's okay. And being okay to make mistakes so that you can learn from them is really, I think, one of the biggest ones. And we talked a little bit about that earlier, but just keeping yourself open and humble to listen and learn from others, no matter who they are. You can learn something from everybody. I think that's message number one. The second thing that I would say is that to remember that leadership is not about you. It's not about you, right? I've learned many times over that a leader's role is to set the stage and to make sure that the people that you're leading, the people that you have a responsibility to, have everything that they need to be successful, that they can do the work that you've empowered them to be able to do. And our job as leaders is to be behind them, to be their biggest supporters, to help move barriers out of their way when they need it, to help get additional resources when they have it. But most of the time, it's our job to stay out of their way and allow them to do great work. And the third thing I would say, to your point, is to really believe wholeheartedly in the power of trust and relationships. Everything starts from there. Everything gets easier if you can build trust and relationships. And I would argue that we should look at every single person around us, whether we're leading up, down, or across an organization. Every single person is somebody that we can learn from. Every single person is somebody who brings a different skill set, a different mentality, who grew up differently than us. In each and every instance, they bring something to the table that we don't have, and we shouldn't be afraid of that. We should embrace that. And in fact, as leaders, I think we should actively, look to increase the diversity of the folks that are around us, to increase the diversity of the people that are on our teams and the people that we have the opportunity to interact with. I think it'll make us better leaders, and I think it'll make our organizations even stronger in the long run.
How can people find out more information about Project Hope, and how can they get involved and help you out?
Great. And like everybody else, I go into projecthope.org is the best place. One of my favorite things about our website is your ability to see the size and scope of the work that Project Hope is doing around the world. And the beauty of it is, while there's simplicity in our mission, there's complexity in the geographies and the people that we're supporting. And as I mentioned multiple times, in the interview, our work looks like whatever is needed by those frontline healthcare workers and the people that we're serving in the places that we operate. Whether that's here in the United States or places around the world, that's first and foremost. So our website's a great place to interact with us. People can check out Health Affairs, which is our policy magazine focused on healthcare issues here in the United States. And of course, folks can follow us in all the social media channels so they can continue to see on a day-to-day basis the amazing work of Project Hope staff and volunteers all over the world.
Very nice. Harley Jones, thank you so much for taking your time to join us today. Hopefully this message gets out. We get some people over to your organization and contributing in any way that they can that will help you kind of move your mission forward.
Great. Appreciate it, Tom.
Thank you for listening to this episode of the $1 Million Nonprofit Podcast. You're here. That means you're ready to take your nonprofit to the next level and make greater impact. Come visit me at realtomkelly.com/playbooks to download free playbooks that your nonprofit can use to start scaling to $1 million in donations, plus much more. Catch the new behind-the-scenes insights in the next episode, and until then, here's to the impact you will make. I'm Tom Kelly. Don't forget to subscribe, share, and encourage others to listen.